Bonjour and welcome to my presentation. My name is Meltem Kutlar Joss. I'm from the Swiss Tropical and Public Health Institute in Basel. I'm a trained environmental scientist and a public health epidemiologist, and I'm working as a project manager of the LUDOK literature database, which in a few seconds I will tell you more about. So today I would like to introduce you to our interactive infograph for communicating health effects of ambient air pollution. But before I start through with that, I said I would tell you what our LUDOK work is. It's mainly a clearinghouse and a database on health effects of ambient air pollution. We realize this on behalf of the Swiss Federal Office for the Environment, with the aim to be up to date with the state of knowledge. And the latest piece of information I can share with you in this regard are the new WHO air quality guidelines, which have been published last Wednesday. And you see in the green column that the World Health Organization has lowered their guideline values in order to further protect public health. And on the right column of the table, you will see the Swiss air quality standards, and we will see what the Federal Commission for Air Hygiene will do with the new air quality guideline values, because as you see, these differ. So back to LUDOK, what are we? We are mainly, the core product is a database where we have a systematic collection of scientific publications on the health effects of ambient air pollution, mainly, mostly epidemiological research, and we have over 10,000 entries now in our database. We use this also to present new evidence on our homepage, which I show you just on the right-hand side here. We use the information in the database to write reviews and reports on the scientific literature by us, or support international efforts to write reviews. We are an information source for the general public, and we have a bi-monthly newsletter, which unfortunately is only published in German, but I would be happy to receive your addresses for the newsletter, which we send out every 2 months. I do not work alone, of course. Our scientific backbone is Professor Nino Künzli, and also my colleague Ron Kappeler, who works on the database with me. On our website, you see here on the left lower corner the possibility to search the database, and you can search it with keywords for authors or by title, and by study type. For example, you can specifically search for cohort studies and so on. Now, coming to the interactive infograph, you can find this on our homepage, and if you go in there, you will see that we have listed a lot of health effects that are stand in relation to different air pollutants. We based this information on the integrated science assessments of the US Environmental Protection Agency, and we used the causal or likely to be causal relationships that they have published there. It looks like this. They have several reports they regularly publish, and this is one of the tables here in the example of nitrogen dioxide, and you see they have deemed short-term effects of nitrogen dioxide on the respiratory system to be causal, so that NO2 really causes the effects that we see and observe in the epidemiological studies. We have developed this infograph jointly with various stakeholders in Switzerland. The Federal Office for the Environment was in the boat, the cantonal offices for air hygiene, policy implementers. We worked with patient and advocacy groups together, the Cancer League and the Lung League. And we had support from a blended learning organization called LernNet, which supported us in the more educational matters of the infograph. So it is interactive. What does that mean? It means that you can choose between short-term, long-term health effects. You can choose which pollutant you are interested in, or if you only want to know, for example, which pollutants affect the lung or the heart and cardiovascular system, you can also look at that. The interactive figure and infograph is also available in French. That's why I'm very happy today to present it to you. We also have it in English, German, and Italian. You can find it on our website and you can use it. You can integrate it in your own websites if you need to, because we have made it publicly available with an open source license. But without further ado, I would like to just demonstrate the interactivity of the figure to you. And switching to the web page, here you have the French version, and you click here on the health effects graph, and there you see the entrance interface, and you can choose between short-term and long-term effects. For example, the short-term effects of ozone, and you see ozone does not only affect the respiratory system, but also is associated with an increase of emergency visits in the hospitals or in doctoral practices due to different diseases. It also affects the metabolism. If you want to know which pollutants also affect the respiratory system, you can click on the lung here, and you see it's not only ozone, but also particulate matter, nitrogen dioxide, or sulfur dioxide. If we go to the long-term effects, the list gets even a bit longer. And the most known effects you can see here for particulate matter, and it affects a bunch of organ systems. In general, we can say there is not one organ in the organism of the human body that is not affected by air pollution. But of course, we have focused on the causal and likely to be causal relationships indicated with the full moon or half moons here. And below our figure, you can find more information on the actual pollution levels, on limit values, sources of air pollutants, and so on. And with that, I stop my presentation, and I'm happy to take any questions via email on this very nice infograph. Thank you very much.